Chapter 45. Nervous Disorders. Every highly complex machine must have a control center someplace where all important decisions are made, where the activities are coordinated. For instance, a large jet plane has powerful engines to carry it through the air, and luxurious space for the comfort of all the passengers. The plane is also well equipped with food compartments, so that delicious meals can be served by charming hostesses who are constantly watching over the welfare of all on board. But while the plane is in flight, there is one spot where all the vital decisions are made. You will find it up front, where the captain, his co-pilot, and the navigation officer are hard at work. During a long flight the passengers may relax and rest, but these men are always on duty, day and night, as long as the plane is in the air. Human control system. So it is with the human body. We have many important organs, such as the heart, lungs, kidneys, and liver, all hard at work, not to mention those fabulous little endocrine glands, such as the thyroid, pituitary, adrenals, and many more. All of these are necessary in keeping us alert and healthy. Other parts of our bodies, such as our eyes and ears, are constantly at work keeping us informed of what is going on. Our digestive organs utilize the food and provide us with energy to keep going at our best. Our hands are forever active, doing what we want done, and our legs and feet are busy carrying us wherever we want to go. Over all this remarkable machine known as the human body, we have a most efficient nervous system, consisting of the brain, the spinal cord, and also the automatic nervous system. This great nerve center is always on the job, ever alert to protect us from danger, and to guide us in all we do. Memory 481. Our most important decisions are made in the brain, some of them quite automatically, others only after careful consideration. Here are the centers of memory, reason, intelligence, and understanding. Here we decide what is right and wrong, what is wise or foolish, what is best and what is not. Once we lose this ability to think and reason, we are little more than animals. Intelligence and understanding are the chief attributes that set man above the rest of the animal kingdom. How we think. There are many stronger animals in the world, but only man has the ability to reason things out for himself, and to set down his thoughts on paper for others to understand. The power of thought is a complex phenomenon, far beyond our capacity to fully understand. Even with the most delicate of modern equipment, we still have much to learn about what is actually going on in the brain. So far as we can determine, thought is an electrical process that depends on many different parts of the brain. To make this possible, all these various parts must work smoothly and harmoniously at the same time. All our thoughts are built up to a large extent from our memories, from scenes or ideas we have previously visualized and experienced. For instance, we are aware of what we see, hear, and feel right now, only because of our previous memories, which have been stored within the brain ready for instant recall the moment we need them. Memory is of the greatest importance, for without it we could never learn, nor could we understand what we see and hear. Our ability to store memories and use them at the right time enable us not only to understand, but also to transmit our ideas to other people. Thus we depend upon memory to guide us in all that we do. But we must weigh and consider each situation, and decide what is best for us at any particular time. Prolonged experience brings maturity of thought, largely because our memories of the past help to guide us in our present decisions. A young child is at a great disadvantage, for his memories are not fully developed. For his own protection, he must be guided by those who are older and whose judgment is more reliable. The thought process 483. Two types of memory. We have two types of memory, one is temporal Y, and the other is more permanent. We use both all the time, but usually in different ways. For instance, many times a day we have to remember certain things, such as when to get up, when to cat, what to buy, where to work, and when to go to bed. Such memories may last only a few minutes. They are more or less temporary, and once we have attended to the matter, we are only too glad to forget them. Permanent memories, such as our name, age, sex, home address, and nationality, remain with us all the time. Most of these memories are formed in childhood, or perhaps after some important event. They are more permanent, probably because of actual changes within the electrical circuits of the brain itself. Thus the last thing an elderly person remembers may be some childhood event that happened 70 or 80 years before. The earlier these memories are formed, the more permanent they seem to be. The ability to remember is probably our most important asset. Without it, we are hopelessly lost and confused. This is what happens when a person has a stroke or some other injury to the brain. Just now you are reading this book. But you can understand what is printed here only because you have already stored in your mind the meanings of letters, words, phrases, and whole sentences. You read rapidly, and as you do so, the memories flash through your mind as vivid pictures take shape within your imagination. This is why we all love to read a thrilling story. But the thought processes do not stop here. These mental pictures stimulate other memories, linking one thought with another until we eventually have a complete picture of some important topic, and from this we make all our important decisions in life. We analyze the information, weigh it, and carefully evaluate it, then decide how and where to use it. All these reactions are taking place right now as you read and study. And thus your whole life is shaped by memories of the past and by your ability to reason and think. How animals communicate. Animals have the ability to some extent, but only in a simpler form. Some animals are able to transmit information to other of 484 nervous disorders. Their kind by scent, scratch marks, and various sounds, but not to any great degree. Thus a hen will sound an alarm and immediately her chicks will take shelter under her wings. Many animals have similar reactions. Bees have a more complicated means of communication. For instance, a bee may find a particularly attractive flower growing some distance from the hive. She then comes back and performs a certain dance. By this means she informs the other bees where to go for honey. This is remarkable in such a small creature. Most other bears of the animal kingdom do not have this ability to transmit information from one to another. They live mainly by instinct. But when we come to man, we are amazed at his ability to reason, and to communicate his thoughts by audible sound. Even more remarkable is his ability to write down these thoughts in readable form for others to understand. Such ability makes possible the accumulation of knowledge and naturally sets him above the rest of creation. Consider the amazing inventions of our modern world in the great fields of space travel and electronics today. Truly there is no limit to what the healthy human mind can accomplish when given the chance. Why some people fail. However, not every baby born into the world has the same capacity for success. Much depends upon the arrangement of genes within that first tiny embryonic cell, the fertilized ovum. The environment in which he grows up will make a vast difference. And even more important will be the use he makes of the talents and opportunities given him. We cannot blame our ancestors for all our failures. The real responsibility often lies within ourselves. Shakespeare understood this so well when he wrote, "The fault, dear Brutus, is not in our stars, but in ourselves that we are underlings." How true! Our own mental laziness is only too often the real reason for our failures in life. Disordered thinking is so common today. Sometimes it is the result of disease. At other times it springs from bad habits of living or perhaps from factors beyond our control. The brain and nervous system are so easily damaged and may even be destroyed by certain. The brain 485. Poisons and injuries that are often the result of our own carelessness. This chapter deals with some of the more important of these conditions. Some are inevitable, others may have been inherited. But most of them arise from our own foolish ways of living. 486 Nervous disorders. Brain waves. All living tissues produce some kind of electrical waves. These waves can now be measured by delicate instruments. The best example of this is seen in the electrocardiograph, an instrument that measures the electric currents produced by the heart muscle itself. Other tissues also produce waves, although in different form and rhythm. All of these have a special meaning of their own, and all are affected by disease. The brain also produces waves, several different kinds of them. These can be graphically traced on a rapidly moving strip of paper, known as the encephalogram. The shape of these waves varies considerably, depending upon the degree of activity within the brain itself. These brain waves will also be different when a person is awake or asleep, probably because all the brain cells are not at work at the same instant. We still have much to learn about waves and their meaning in various types of nervous disorders. However, brainwave studies are most valuable in investigating the different types of epilepsy and in trying to find the cause of the trouble. Brainwave studies may also reveal the presence of tumors and other lesions within the brain itself. Pain. Nerves are found in all parts of the body. Some carry electrical impulses to the muscles, telling them how and when to move. These are known as motor nerves. Others carry sensations back to the brain. These are referred to as sensory nerves. Thus we can tell when we are lightly touching an object, or are exerting heavy pressure against it. We can also tell whether the thing we are touching is warm or cold. All of these sensations are carried by different nerve fibers. But the fibers we are most concerned with are those that carry the sensations of pain, for pain is one of nature's important warning signals, letting us know that all is not well. Pain can be felt in almost all areas of the body, but in some parts the pain is more likely to be severe. One should never be satisfied just to relieve pain. There is always some underlying cause that should be investigated. Some people have a lower pain threshold than others. This means they are more likely to feel pain. Much will. Headache causes 487. Depend upon the nervous background of the individual and whether he has ever experienced this sort of thing before. There are many different causes of pain in the body. For instance, a pain in the chest might be due to heart disease, arthritis of the chest wall, radiculitis, neuritis of the peripheral nerves, various lung conditions, such as tuberculosis, pleurisy, pneumonia, and even tumors of the lung. Pains in the abdomen might arise from a diseased gallbladder or appendix, or from a peptic ulcer or a diseased pancreas, or from a blocked blood vessel, intestinal obstruction, or conditions affecting the liver, spleen, kidneys, ureters, and many more. Pains in the extremities may be due to arthritis, fibrositis, myositis, various injuries, or perhaps chemical changes in the bloodstream. Never forget that pain is an important sign of trouble within the body. It should never be neglected. Nor should one be tempted to take some simple pain-killing medicine and forget the discomfort. This is particularly important if the pain tends to recur. A careful physical examination should always be done. And even though nothing may be found by the doctor, you at least will have done your part to be sure there is nothing more serious. Headache. Headache is one of the most common of all symptoms afflicting the human race. Most headaches are more or less transient, here today and gone tomorrow. But some seem to recur frequently over periods of months or years. Such headaches may be due to a wide variety of causes, such as various tumors, infections, head injuries, high blood pressure, eye conditions, infections of the nose, throat, and ears, and many more. However, most headaches have no organic cause. Many are due to megrim or some psychological disturbance resulting in a tension headache. One should never assume that his headache is due to some serious disease, for most headaches are functional and not related to any organic changes in the brain. Even eye strain is a far less common cause of headache than many people suppose. Strange as it may seem, the brain itself is not sensitive to pain. This means that most headaches are not due to any actual damage within the brain itself. However, any stretching or pressure on the F32 coverings of the brain or the large blood vessels within the head will most certainly produce a severe pain or headache. Any inflammation within the head, such as occurs in meningitis, will cause extreme pain over the entire head. Such causes are extremely rare today. A tumor growing within the head may press upon the meningeal covering or dura. This causes a severe headache, which is usually felt on the side of the head where the tumor is located. Megram attacks 489. Megram headaches. Megram headaches are among the most common forms of headache today. In most cases they come on when a person is either under intense nervous strain or when the tension suddenly subsides and he takes a day off. This type of headache is often preceded by flashes of light which are seen the sides of one's vision. This is most likely to be a one-sided headache, and there may be numbness and tingling on that side of the face or body. Some patients complain of a blind spot in their vision. Megram is so common that 1 person in every 10 has it at some time or other. It is most common in early adult life, women being more frequently affected. Often there is a history of Megram headache in the family. Fortunately, this type of headache usually begins to subside after the age of 50. Megram attacks are often preceded by short periods of depression, irritability, restlessness, and loss of appetite. These symptoms tend to disappear just before the headache comes on, or they may continue and even increase the pain. This of headache usually follows a definite pattern. In one attack the right side of the head may be involved, in the next perhaps the left. In many cases there is nausea, vomiting, and the extremities may feel cold, and the patient desires just to be left alone. Careful observation of the blood vessels on the side of the head will show that they are prominent and pulsating. The attack may last for hours or days at a time. Some patients may have it daily, others at odd times, and still others, perhaps only once or twice in several years. Megram headaches are usually thought to arise from some reflex spasm or tension one of the arteries leading to the brain itself. This reduces the normal flow of blood to that area. Just above the spastic portion to the vessel the walls of the artery lose their normal tone and become greatly dilated. This causes intense pulsations and stretching of the wall of the vessel, producing acute pain and headache. This is the theory. No one knows for sure. Treatment: in the early stages, some simple pain-relieving medicines such as aspirin may be given every 2 hours as needed. In more severe attacks, ergotamine tartrate should be given, but this is effective only when taken in the early stage before the headache has lasted 2 hours. The usual dosage of ergotamine tartrate is 1 cubic centimeter given. 490 nervous disorders. By injection just under the skin. This may have to be repeated in 1 or 2 hours if necessary. Ergotamine tablets containing caffeine, such as Caffergot, are also valuable, provided the patient is not vomiting. The usual dose is 2 tablets, given at the beginning of the headache, with 1 additional tablet each half hour up to a total of 6 tablets, or until relief is obtained. Ergotamine tartrate is also available in the form of rectal suppositories. DHE45 is another form of ergotamine which is useful in treating an acute attack. Treating a sick headache. The best treatment for a sick headache is to prevent it from coming on. Megram headaches always arise from the stress and strain of living. This evidently builds up some kind of electrical storm within the brain, and from there the trouble may spread to the stomach and intestinal organs. Here are some suggestions for treatment. 1. Do not be quite so exacting with yourself and with others. Plan your work well, but don't fret or worry when things go wrong. It may not always be your fault. 2. Get plenty of sound sleep each night. Also, take a short nap in the daytime if you can. This will help to relieve tension and restore your sense of well-being. 3. Beware of habit-forming drugs. These may bring quick relief, but they do not remove the cause. It is so easy for a person to become addicted to powerful drugs. Better leave them alone. 4. Avoid things to which you are sensitive, such as bright lights, loud noises, tobacco smoke, strong perfumes, heavy traffic, and perhaps even some of your neighbors. Don't allow yourself to exceed your own limits. 5. A hot foot bath for about 20 minutes will often relieve severe headache. An ice-cold cloth to the head will also bring relief and make the hot foot bath even more effective. 6. Avoid nervous tension. Get sufficient exercise out of doors, especially walking. This will relieve tension and help to prevent headaches. Gentle massage to the neck and back will often bring relief. 7. Keep calm and quiet. You cannot always have your own way, even at home. Remember, a happy attitude toward life is one good way to prevent these tensions from coming on in the first place. Some types of headache. 491. So, try to face your problems bravely, without fear or weakness. A calm, quiet atmosphere will bring peace within yourself, and with others, and with God. Tension headache. Tension headaches are similar to Megram in many respects, although the location of the headache may be somewhat different and the cause is more obvious. Prolonged tension often seems to produce a spasm of the muscles in the back of the neck, particularly in certain people. This muscle spasm draws the tissues over the surface of the cranium very tight, so that the pain is felt not only in the back of the neck, but also over the top and front of the head. This is a steady, aching type of pain. Usually there is no nausea, vomiting, or flashing lights, for the problem does not appear to affect the brain but is due to external causes. The treatment is similar to that outlined for Megram and sick headaches, as mentioned on pages 489 and 490. It is most important to avoid emotional stress and be sure to take sufficient rest. Tension headaches are warning signals from nature which one cannot afford to ignore. Alcoholic headache. Many people suffer from a severe headache due to hangover after taking large quantities of alcohol. Alcohol is toxic to the tissues and directly irritates the meninges or coverings of the brain, thus causing pain in the head. The alcohol also dilates the arteries in the brain, and this in turn produces a pain not unlike that of Megram. Naturally, the best treatment for this type of headache is to avoid the excessive use of alcohol in any form. Other than this, bed rest is advisable until the crisis has passed. Headache due to constipation. Some people are particularly susceptible to this type of headache. It appears to arise from absorbing toxic products from the colon. The best treatment is to take sufficient bulk and roughage in the diet, plus at least 6 to 8 glasses of water per day to provide both bulk and 492 nervous disorders. Lubrication of the bowel. Some mild laxative may be necessary in some cases, but this should be avoided as a general rule. Headache due to high blood pressure. Many people have a tendency to develop a headache when the blood pressure rises beyond the normal level. The reason for this is not too clear, but it may be due to the increased pressure within the smaller arteries and other blood vessels within the brain. High blood pressure and its treatment are more fully discussed on page 247. Sinus headache. Some of the nasal sinuses lie very close to the brain. Any inflammation within these sinuses may produce a rather severe type of headache. Sometimes the headache comes on gradually, at other times rather quickly. There may also be marked postnasal discharge or dripping down into the throat, as well as fever, loss of appetite, dizziness, and loss of the normal sense of smell. A feeling of toothache might also be present if the maxillary sinuses are involved. During the early phase, the temperature may rise to 102 degrees. Anything higher than this suggests further complications, such as otitis media or inflammation of the middle ear. In chronic sinusitis, the headache is less severe and the patient may complain of recurrent colds. Sinusitis and its complications are discussed on page 403. Headache caused by eye strain. This type of headache may be due to the body's attempt to gain clear vision. Within the eyeball, the small ciliary muscles control the shape of the lens of the eye. This enables us to focus our vision on the object we are looking at. Prolonged contraction of these tiny muscles can be a cause of headache due to eye strain. Also, the muscles that move the eye, extraocular muscles, may go into tension, particularly if the muscles controlling one eye are not balanced with those on the other side. This imbalance may cause blurring of vision, so that the head may have to be held in a certain position in order to focus the vision. This in turn causes chronic contraction of the muscles of the neck, resulting in a headache. Inflammation of nerves 493. If the eyes are exposed to a very bright light, a headache may develop lasting 24 to 48 hours, possibly due to irritation of the delicate tissues in the eyes. Such a headache may last from 1 or 2 days. Looking at the sun for only a few seconds may actually burn the retina, and cause a severe headache. The proper treatment for headaches arising from eye strain and other disorders of the eye can be prescribed only by a specialist in eye conditions, or in other words, an ophthalmologist. Neuritis and neuralgia. Neuritis. Neuritis means inflammation of the nerves, possibly involving a single nerve or a group of nerves. At times several different groups in various areas of the body may be involved, a condition referred to as polyneuritis. Neuritis may arise from a blow, a penetrating injury, a bad bruise, or heavy pressure over a nerve trunk. Dislocations and fractures of the bones may result in various forms of neuritis. Tumors may also bring this about. Any violent muscular activity or overextension of the joint as in a sprain may injure the nerves and cause neuritis, the pain being felt along the course of the nerve. Excessive vibration from machine tools, such as air hammers, may eventually produce the same inflammation of one of the nerves. So will a cramped posture, as in gardening. Certain infections, such as leprosy, tetanus, and tuberculosis, may sometimes produce pain in the nerves. Herpes zoster or shingles is a form of neuritis arising from some virus infection involving certain nerves. The pain from shingles may continue for months or even years. This condition is more fully discussed on page 495. Certain heavy metals, such as lead, arsenic, mercury, bismuth, copper, and manganese, may at times cause a toxic neuritis. This is also true in such nonmetallic poisons as alcohol, carbon monoxide, carbon tetrachloride, benzene, and also certain drugs. Vitamin deficiencies, particularly when adequate amounts of vitamin B complex are not present in the diet, may produce polyneuritis. This is often seen in alcoholism, pellagra and other serious conditions. The chief symptoms of neuritis are tingling or pins and needles, and also burning, boring, or stabbing pains in the affected nerves. In the more severe cases, there may be numbness and loss of sense of. 494 Nervous disorders. Sensation, and the nearby muscles may be paralyzed. Bell's palsy, temporary paralysis of the face, arises from inflammation of the facial nerve on the affected side. During the acute stage of Bell's palsy, the patient is not able to close the eye, because the muscles on that side of the face have lost their normal tone and strength. The patient then finds he can only grin on the other side of the face, and his mouth is pulled out of shape. Patients with pernicious anemia may also suffer from neuritis involving the nerves of the spine. There may not be any pain, but such people may have difficulty walking in the dark. This can now be readily corrected by the use of vitamin B12 injections. All cases of neuritis should be thoroughly investigated to be sure the patient does not have diabetes or some other underlying disease. Arthritis and fibrositis may sometimes be mistaken for neuritis. Wherever possible, one should treat the underlying condition. If the trouble is due to some injury, or a ruptured disc in the spine, bed rest with traction may be all that is needed. Apply hot moist packs, as suggested on page 96. Some mild pain-relieving medicines such as aspirin may be needed to keep the patient comfortable and free from pain. The diet should be high in proteins and vitamins, especially in cases of infectious or toxic neuritis. As the pain subsides, more active exercise should be encouraged. If the pain is very persistent, the affected nerves may have to be blocked by anesthesia or some suitable surgical procedure. Neuralgia. This is an acute severe pain for which no basic cause can be found. It is most often associated with neuritis as mentioned above. Trigeminal neuralgia or tic douloureux is one form of neuralgia which is marked by brief attacks of severe pain along the branches of the trigeminal nerve. This is the large sensory nerve of the face and head. There is intense stabbing pain in the side of the face and around the eyes. At first these pains may last for 1 to 2 minutes, and then the patient may have no more pain for several weeks or months. As the disease advances, the patient notes that parts of his face are more sensitive, and the pains come more frequently when these areas are touched. In treating neuralgia, follow the plan outlined for neuritis. See above. In very severe cases of tic douloureux, it may be wise to have a neurosurgeon inject some suitable medication into the nerve. If this does not relieve the pain, then the nerve may have to be calm. Sciatica and Shingles 495. Completely severed by surgery. But wherever possible, the milder methods of treatment are preferred. Sciatica is a severe type of pain felt along the back of the thigh and leg, along the course of the sciatic nerve. This is the longest nerve in the body. It sends branches into the thigh muscles, the knee joints, and down into the muscles of the legs and feet. The sciatic nerves begin in the lower part of the back and pass down behind the thigh. This means they are more exposed to injury and inflammation than most other nerves. Any type of injury to the spine may cause sciatic neuritis, because of compression of the sciatic nerve at its roots. Any infection or toxic material near the area of the nerve may result in sciatica. But in 90% of cases the trouble is due either to a ruptured disc or else osteoarthritis of the lower spine. Other causes include pregnancy, tumors of the pelvis, and deformities of the lower spine. The sciatic nerve may even be injured by walking, running, or riding a bicycle. Prolonged standing, or sitting on one side of the edge of a chair may lead to sciatica. In the case of a ruptured disc, the pain is often aggravated by coughing, sneezing, bending forward, or straining at the stool. Often the pain disappears with bed rest, only to return days or weeks later after some slight injury or extra exertion. All patients with sciatica should be given a thorough physical examination, especially if there is any question of injury or infection. The pelvic organs should also be thoroughly examined for tumors or other abnormalities. X-rays should be taken of the spine, pelvis, and lower extremities to rule out any defects or tumors. In treating sciatica, first apply hot moist packs and gentle massage, as suggested in Chapter 11. Best rest, plus the use of SIMPLE pain-relieving medicines, such as aspirin, empyrin, or Darvon compound, will often work wonders. In some cases it may be wise to wear a support. It should be well fitted and properly padded to protect the skin. Local heat should be applied over the irritated nerves in the thigh and leg, using a heating lamp, hot water bottle, or electric pad. Many cases will respond well to such simple treatments. But a herniated disc may have to be removed by surgery. 496 Nervous disorders. Shingles or herpes zoster. Shingles or herpes zoster is a severe infection of one or two large nerves. It usually occurs on one side of the chest or abdomen. Shingles always begins with severe pain along the course of the involved nerve. After a few days there is a painful itching rash, lasting several days or weeks. Shingles results from a filtriable virus, the same or similar to the one that causes chickenpox in children. It is strange that such a simple children's disease should be so much more painful in adult life. Shingles occurs most frequently in early summer and late autumn. It is not a skin disease, but a severe form of neuritis involving one or more of the nerves. The course of the nerve is clearly outlined by the skin rash that appears later. Most cases of shingles occur on the chest or abdomen, but there are times when it may involve one of the eyes, causing severe swelling and itching. Unless properly treated, it may also cause ulceration of the cornea. Treatment: large doses of vitamin B1 to 1000 micrograms per day for several days, may reduce the inflammation in the nerve. Protamide, 1.3 cubic centimeters per day for several days may also help. The irritated skin should be covered with collodion or tincture of benzoin to keep out the air. Cortisone or prednisolone tablets are also valuable and may be taken once or twice a day. Most cases of shingles clear up in 2 or 3 weeks, often sooner. But there is usually some sensitivity over the affected area, and even pain at times, which may continue for months or even years. As far as possible, the patient should carry on his normal activities and try to ignore the discomfort and irritation in the skin and nerves. Convulsions and epilepsy. Epilepsy is a serious disorder of the brain, characterized by periods of unconsciousness, lasting from 2 or 3 seconds up to several minutes. These attacks are often accompanied by convulsions in which the patient falls to the ground. There are 4 main types of seizures: grand mal, petit mal, Cycomata attacks, and epileptic equivalents. Each follows its own specific pattern. No one knows the true cause of epilepsy, but no doubt some abnormal electrical discharges occur within the brain tissue and these cause the seizures. In cases of epilepsy, a doctor's services are advisable. Convulsions 497. Grand mal seizures are violent contractions of the arms, legs, and body, accompanied by a sudden loss of consciousness. Some patients have a warning or aura just before the convulsion begin. In a typical attack, the patient cries out, loses consciousness, fall to the ground and goes into a severe tonic spasm followed by jerky movement of the extremities, trunk, and the head. The patient may lose control of his urine and feces. The attack may last several minutes, and is usually followed by a deep sleep. On waking, he complains of a severe headache and soreness in the muscles. Blood may ooze from his mouth, because he may have chewed his tongue during the severe muscular spasm. During the convulsion, loosen all tight clothing, including the collar. Place on a pillow or coat under the patient's head, and hold a handkerchief any or other padded cloth between the upper and lower jaws to prevent biting of the tongue. When the attack is over, let the patient rest and sleep as long he wishes. As far as possible, encourage him to live normal life, avoiding all nervous stress. He should not drive a car, or work at any occupation requiring the use of an open fire or moving machinery. Epileptic children should attend school and participate in sports or other activities. This will help them to gain confidence in themselves and make them feel happier at home. Dilantin sodium, 100 mg once or twice a day, is usually sufficient to keep the patient free from attacks. Phenobarbital, 1/4 to 1/2 gain 2 or 3 times a day, may also help, especially in more severe cases. Petit mal is less serious form of epilepsy. The patient has a momentary loss of consciousness, lasting for a few seconds. He may suddenly stop what he is doing and then resume it when the attack is over, not even being aware of has happened. Perhaps he might find that he has dropped a cup or some other objects he is carrying. Petit mal attacks may occur at any time in life but are most frequently seen in children. Tritium several times a day is the recommended medicine. Cycomata attacks are minor seizures in which the patient loses contact with his environment for perhaps 1 to 2 minutes. He does not fall but may stagger around performing automatic, purposeless movements and making unintelligible sounds. During the attack he does not understand what is said and may resist any aid. He may be confused and mentally clouded for a minute or two after. 498 nervous disorders. The attack is over. Tritium several times a day is the recommended medicine. Epileptic equivalent is a rare form of epilepsy in which patients may have attacks of abdominal pain and also periods of mental cloudiness lasting up to several hours. The treatment is the same as for petit mal. Poisoning. Convulsions may sometimes follow poisoning from certain drugs such as strychnine, atropine, lead, and caffeine. The appropriate antidote should be administered immediately, as outlined on page 140. Convulsions sometimes occur in young children at the beginning of a fever or some more serious disease such as meningitis. Emotional upsets and hysteria will sometimes cause convulsions in certain people. However, this is different from epilepsy in that the patient is able to control the urine. The most violent convulsions of all are due to tetanus, see page 112. Tics and habit spasms. These are sudden habitual purposeless movements of certain muscles of the face or body. They may occur at any age, but are more common in nervous children between 5 and 12 years. Occasionally these habit tics follow encephalitis. The child may have involuntary blinking of the eyelids, shaking or nodding of the head, pouting, grinning, clearing the throat, shrugging the shoulders, or perhaps a combination of several of these. When he is upset or tired, the movements become more intense, but usually disappear during rest and sleep. As he grows older, the peculiar habit may disappear, but in a few cases it may become worse. All such children should be under the care of a psychiatrist. Meanwhile, keep the child quiet and avoid all nervous strain. Some mild sedative, such as reserpine 0.25 million guaranis or butasol sodium 0.5 gr once or twice daily, may help the child to overcome this problem. Nail biting. Nail biting is a common sign of nervous strain. Once developed, it is a difficult habit to break, particularly during adolescence. In solving this problem, try to remove every known cause of worry and anxiety. Be sure to take sufficient rest and avoid overexcitement. Some people apply various bitter-tasting substances to the nails, but these do little good, for they do not remove the cause of the trouble. Remember, nagging and unkind criticism only lead to further tension and unhappiness. Be sure to provide plenty of wholesome outdoor. Stammering, stuttering, hiccups 499. Exercise, including frequent deep breathing. This increases the blood circulation and helps to get rid of the nervous tension. Meanwhile, keep the nails short and smooth, so there will be less temptation to bite them. Stammering and stuttering. Stammering and stuttering usually begin in early childhood, and unless properly handled, this serious handicap may continue for the rest of a person's life. Because of nervous tension, the child may find himself unable to say the right word. He becomes flustered and wrong sounds come out. Laughing at him will only deepen his embarrassment. Try not to be too concerned. Speak slowly and correctly and keep him calm and quiet. Remember, this is not a speech defect. It arises from nervous tension and anxiety. But there is a brighter side to this, for some of the world's greatest orators have also suffered from this problem. In their determination to master this annoying habit, they have been able to discipline themselves and thus overcome a most serious handicap. Hiccups. Hiccups are short contractions of the diaphragm or large muscle dividing the chest from the abdomen, resulting in crowing or gasping sounds. The cause is not always clear, but certain nerve pathways seem to be irritated, perhaps by swallowing hot foods or some disorder of the stomach, esophagus, or pancreas. In a few cases, peritonitis may be responsible. Hiccups are sometimes seen in typhoid and also in amoebic infections. Liver conditions may also cause hiccups, and attacks may even occur during pregnancy, probably because of bladder irritation. Hiccups are sometimes associated with pleurisy, pneumonia, uremia, and drunkenness. Treatment: try simple measures, such as deep breathing, or drinking a glassful of water rapidly. Holding the breath or breathing into a paper bag will help to build up the carbon dioxide in the body, and this may relieve the hiccups. Tickling the nose or throat is also beneficial. Pulling on the tongue, swallowing dry bread or crushed ice, or pressing on the eyeballs, any of these may be tried. Sometimes a mild sedative, such as phenobarbital, will relieve the condition. In more severe attacks, chlorpromazine, Largactil, 25,500 nervous disorders. To 50 mg 2 or 3 times a day may be tried. For uncontrollable hiccups, it may be necessary to consider surgery on one of the phrenic nerves, but this is the last resort when all else has failed. Parkinson's disease. Parkinson's disease, or shaking palsy, is a chronic condition of the central nervous system that may follow an attack of encephalitis, or some type of poisoning, such as carbon monoxide. In older patients, this type of palsy may be due to hardening of the arteries in certain vessels leading to the brain. Often there is no known cause. In the more advanced stage of Parkinson's disease, the patient may have a staring expression and unblinking eyes. The face muscles are flattened or smoothed out, losing the normal expression. Saliva drools from the slightly open mouth, the skin appears greasy, and the patient walks with a short, shuffling gait, with his head bent slightly forward and his hands held stiffly at the side. His muscles are somewhat rigid and stiff, so that when he moves his extremities there may be a series of little jerks, a so-called cogwheel rigidity. Usually there is a tremor of the hands, head, and other parts of the body, depending on how far the disease has progressed. These tremors are more noticeable when the patient is at rest, and tend to disappear when he attempts to move or when he is asleep. When he is excited or fatigued, the tremor is more pronounced. Later there may be impairment of speech, and the patient may complain of cramping pains in the back because of muscle spasm. His mind usually remains clear, and his other sensations are normal. In many cases the patient may have only a mild form of Parkinson's and continue this way for many years before any serious symptoms develop. Treatment: everything possible should be done to help the patient to maintain a cheerful mental outlook. Keep him as active as possible. Apply hot moist packs and gently massage the stiffened muscles, following the methods outlined on pages 96 to 104. Use some simple pain-relieving medicines, such as aspirin, to relieve the cramp-like pains. If the patient seems unusually tired and weary, he may benefit by taking a 5 mg tablet of amphetamine in the morning and another at noon. Medicines containing belladonna are also useful. They help to decrease the tremor and excessive production of saliva. The usual dose is 1 capsule or tablet 3 times a day. After meals. Nerve tremors 501. Newer surgical operations for the control of Parkinson's disease are now being carried out at some of the larger medical centers, but it is best to try a simple medical program first. Tremors. A tremor is an involuntary movement of one or more parts of the body. Among the most frequent types of tremor are those arising from Parkinson's disease, multiple sclerosis, and hardening of the arteries leading to the brain. Drug addicts, especially those who are habituated to morphine, cocaine, and opium, may show a coarse, slow tremor, involving the face and extremities. Another very frequent type of tremor is seen in alcoholics, especially in the early morning. This tremor is most severe during an attack of delirium tremens. Patients with thyroid disease may also show a fine tremor, particularly when the hands and fingers are stretched out. Another fairly common cause tremor arises from anxiety and nervous. 502 Nervous disorders. Tension. This may also be seen in hysteria. Suggestions for treating these various diseases are found elsewhere in this book. Cerebral palsy. Cerebral palsy is a very serious disability that probably begins at birth or perhaps is due to some defect before birth. In most cases the true cause is unknown. As the baby grows he may be small and underdeveloped, but in some cases he may seem quite normal at first. Later he may fail to sit up at 6 months, or to talk and walk at 1 year. During his second and third years he may have convulsions and peculiar meaningless movements of the extremities. The muscles of the extremities are likely to be spastic, both sides usually being involved. Swallowing may be difficult and the child may appear somewhat retarded, usually because of the difficulty in expressing himself. However, his mind may be quite clear. Treatment: milder cases should be encouraged to live as normal a life as possible. Weakened muscles may need to be re-educated, and special splints used to support the extremities. Many of these patients are mentally bright, their slowness being due only to their physical handicap. Most of them make good progress under special courses of study, speech training, and vocational guidance. Dizziness. Vertigo or dizziness is an unpleasant feeling or sensation of spinning or lack of normal balance. There are many different causes of dizziness. Infections of the ear may result in labyrinthitis, or inflammation of the normal balancing organ located in the inner ear. Otosclerosis, or hardening of the bone through which the eighth nerve passes, is another cause. Meniere's disease, discussed on page 613, is another common cause. Various drugs of the aspirin variety, as well as narcotics, nicotine, caffeine, streptomycin, and alcohol, all may cause toxic disturbances leading to dizziness. Motion sickness, sunstroke, eye strain, glaucoma, high blood pressure, hardening of the arteries leading to the brain, are also fairly common causes of dizziness. Heart failure, anemia, and leukemia may sometimes be responsible. Infectious diseases such as influenza, typhoid, encephalitis, measles, mumps, shingles, syphilis, epilepsy, and multiple sclerosis may also cause vertigo or dizziness. The treatment depends on finding. Strokes 503. The cause of the trouble and relieving the condition as far as possible. Temporary relief is usually obtained by using such medicines as Dramamine, 50 mg every 3 to 4 hours, or Antivert, a medicine containing large amounts of niacin, taken 3 times a day. Strokes. The brain is a delicate organ requiring a constant supply of blood. A stroke occurs when one of the vessels leading to a portion of the brain becomes blocked by a blood clot. This may be due to inflammation, arteriosclerosis, or perhaps the presence of a clot or embolus from the heart. Occasionally one of the vessels leading to the brain may rupture because of a small aneurysm or balloon-like enlargement in the wall of the vessel. This will cause a serious hemorrhage. Any sudden elevation of blood pressure due perhaps to some emotion such as anger may rupture the aneurysm. A stroke of apoplexy, also known as cerebral vascular accident, is the most common form of brain disease, particularly in the older years of life. Most strokes are due to thrombosis or clotting of blood within the vessel. When this happens, that portion of the brain becomes necrotic and dies. Often the first sign of trouble may be a sense of dizziness, followed by nausea and vomiting, and later by weakness or paralysis on one side of the body. The patient may complain of a severe headache, and may even have a convulsion, or pass into a coma from which he cannot be aroused for some time. He may be completely paralyzed on one side and may not be able to speak. His mind may remain clear, but for some time he may not be able to recall the actual words he wants to use. Many strokes occur suddenly and tend to clear after a few hours. In more serious cases the patient may remain in a deep coma for several days. He may have a fever, a rapid pulse with labored breathing. However, if the coma lasts more than 6 hours and the patient passes through periods of convulsions with stiffness in the severe neck, and with the eyes turned sharply toward the paralyzed side, the condition is probably due to a hemorrhage of the brain. A severe hemorrhage is usually fatal in 2 or 3 days, especially if the patient runs a high fever and a rapid pulse. Patients are more likely to recover if the stroke is due to thrombosis. F33. 504 Nervous disorders. Most stroke patients manage to recover, especially if only a small vessel is involved. Many of them do not even lose consciousness, but the weakness or paralysis may drag on for a long time. Some permanent disability is to be expected, even with the best of care. Treatment: good nursing is most important in all stroke cases. Keep the patient in bed and follow the suggestions on page 506. If the patient is in a coma, it may be necessary to use a retention catheter to keep the bed dry. Patients not in a coma should be treated as normally as possible. If the stroke is due to a brain hemorrhage, the clot may be removed by surgery. Every effort should be made to encourage the patient to use the paralyzed limbs. Gently massage the paralyzed muscles and move all the joints several times each day. As soon as possible, get the patient out of bed and let him walk around the room. If his speech is affected, he may benefit from the services of a speech teacher. More serious cases are best treated in hospital, but most elderly patients can be well cared for at home. Head injuries with hemorrhage. Any injury to the head may cause a subarachnoid hemorrhage, or bleeding into space between the covering tissues of the brain itself. The hemorrhage may also arise from some congenital aneurysm or ballooning of the vessel as mentioned above. Usually there is a severe pain in the head, followed by nausea, vomiting, loss of consciousness, and perhaps convulsions. To establish the diagnosis, the doctor may pass a long, flexible needle into the patient's back and draw off some of the spinal fluid for a cell count and other laboratory tests. He will also test the pressure in the cerebrospinal fluid, and if it is very much elevated, he may decide to repeat the spinal tap several times during the course of the illness. Special tests, including a cerebral angiogram, may be needed to establish the diagnosis, and also as a guide to possible surgery. All patients with brain injuries should be treated in hospital. Concussion. Concussion is a serious condition involving the brain and central nervous system. It is usually caused by a violent shock or concussion, and its treatment 505. Jarring of the head and is followed by nausea, dizziness, a weak pulse, slow respirations, and temporary loss of consciousness. Concussion is almost always associated with some type of head injury, either due to a fall, a traffic accident, or perhaps a blow on the head. The brain is a very delicate organ, and is encased in a hard bony cavity, the cranium, or skull. Within this cavity the brain itself is surrounded by a watery liquid, the cerebrospinal fluid. Tiny tendrils of tissue, including many small blood vessels, help to hold the brain in place. These are easily snapped or torn by a heavy blow. Any injury to the head is likely to result in a great deal of commotion within the brain, and this is reflected in the sudden loss of consciousness, shock, nausea, and other signs of serious injury. Recovery is often slow, and there may be periods of dizziness for weeks or months, particularly after a highway accident or a bad fall. Treatment: keep the patient quietly resting in bed and apply an ice bag to the head. Check the pulse frequently to determine its regularity and volume, and take the patient's blood pressure every hour until it is stabilized. If the patient is in shock, treat as suggested on page 109, raising the foot of the bed 6 inches higher than the head. If the patient's head has been injured by a blow or fall, be sure to have X-rays taken of the skull, but not before the patient is in a condition to do so. Watch carefully for any difference in size between the pupils of his eyes. If one pupil appears larger than the other, or if the patient has a gradually increasing headache, call your doctor at once. Any evidence of paralysis in the face or any part of the body should also be reported. Vomiting is to be expected after most injuries involving the head. Suppositories containing Dramamine, Vistaril, Campazine, or other such medicines, are often useful in controlling the nausea and vomiting. If the X-ray shows a fracture or crack in the skull, and there is no displacement, the fracture will usually heal without any special treatment, provided the patient's condition is not getting worse. If the bones of the skull are depressed, call an ambulance and transfer the patient to hospital at once. He should be kept under observation for at least 48 hours. Bleeding scalp wounds should be cleansed and drawn together with sterile sutures to prevent further loss of blood. If this cannot be done, cover the injured area with a sterile dressing to prevent further contamination. 506 Nervous disorders. Brain tumors. Tumors of the brain are not common. They may cause various symptoms such as headache, nausea, vomiting, and even convulsions in a few cases. Any patient showing marked drowsiness, or a change in personality, such as disorderly conduct, or an impairment of normal mental faculties, or even a frank psychosis, should be seen by a qualified neurologist or neuropsychiatrist. The trouble could be due to brain tumor that might be either benign or malignant. Treatment: some tumors, such as pituitary adenomas, can be treated by X-ray, but wherever possible, it is best to have the tumor removed by surgery. Encephalitis. Encephalitis, or inflammation of the brain, is fortunately rather rare. This very serious disease is usually associated with certain viruses, some of which are carried by mosquitoes, ticks, and other vermin. Encephalitis may also follow such infections as measles, chickenpox, smallpox, influenza, mumps, and even the common cold. The disease usually begins suddenly with a fever and perhaps convulsions, headache, drowsiness, delirium, and paralysis of the bladder and extremities. Treatment: good nursing care is most important, particularly during the acute stage. Keep the patient quietly resting in bed, and turn him frequently from side to prevent pressure sores from developing. Give careful attention to the bowel and bladder. Fluids may be given by vein, particularly to stuporous patients. A tepid sponge bath, followed by an alcohol sponge, will help to bring down the fever. Apply an ice bag to the head. Delirious patients may be given paraldehyde, as directed by a physician. The diet should be light and easily digested. The patient should be protected from visitors, telephone calls, and any form of excitement. He should not return to work for several months. With proper care, the outlook is fairly bright, provided the patient rests long enough to make a full recovery. Meningitis. Meningitis is a severe inflammation of the meninges or coverings of the brain and spinal cord. It may follow an attack of otitis media. Multiple sclerosis 507. Middle ear disease, mastoiditis, brain abscess, or even tonsillitis. Any skull fracture or penetrating head wound may result in meningitis. There are times when tuberculosis may extend to the brain and cause meningitis. Patients with this disease usually have a high fever, severe headache, and pain and stiffness in the neck and back. Epidemic meningitis or spotted fever sometimes occurs in densely populated area during the cold season. The germs are apparently spread by persons who have a mild sore throat or cold. The patient usually has a severe headache, a high fever, and soon becomes confused. He may have an attack of convulsions. Vomiting is common in epidemic meningitis. Antibiotics, such as penicillin and terramycin, are of value. So is sulfadiazine, the average dose for adults being 6 to 10 tablets a day. If the patient is vomiting, give the medicines by injection. For meningitis, a doctor's services are important. Multiple sclerosis. Multiple or disseminated sclerosis is a chronic disorder of the central nervous system, in which the nerves become demyelinated or lose their normal covering. The true cause is not known. The patient may complain of weakness on one side of the face with heaviness of the limbs and partial blindness in one eye, or perhaps double vision. If the brain is involved, he may have convulsive seizures, or one-sided paralysis, and be subject to crying spells, forced laughter, or other signs of involvement of the nerve pathways controlling the emotions. He may also have tremors and slow speech. In the milder form, the patient may show nothing more than a lack of normal judgment. Speech may be hesitant, the patient knowing what he wants to say but unable to speak the words normally. Tremors are common, and the movements of the extremities are irregular and weak. He may walk with a stumbling, weaving type of gait. This is a disappointing type of disease. Sometimes it tends to clear up, only to return several months later. Treatment: unfortunately, there is no known cure for multiple sclerosis. Many patients have benefited by various medicines for a time only to find that sooner or later the old problem returns. The patient should avoid overtook and fatigue. Weakened muscles should be given massage, and all the joints should be put through their normal range of motions every day. This will also help spastic muscle. Keep 508 nervous disorders. The patient at his normal occupation as long as possible. Give him extra vitamins, particularly nicotinic acid or niacin, 100 mg 3 times a day, and thiamine, in addition to vitamin B12. Cortisone products may give temporary relief, but may not affect the general course of the disease. Most patients with multiple sclerosis will have less trouble in a warmer climate. Muscular dystrophy. Muscular dystrophy is a hereditary disorder of unknown cause, involving both nerves and muscles. It usually begins early in childhood. The child walks with a clumsy gait, tends to fall, and then has difficulty in getting up without help. As he grows older, he will learn to rise on his hands and knees, and then help himself by climbing up on his own legs. There are several different forms of this disease, but unfortunately, there is no recommended treatment, other than massaging the muscles and keeping the patient as comfortable as possible. Myasthenia gravis. In this disease, the muscles are weak and there appears to be some delay in nerve conduction at the point where the nerves join the muscles. The true cause is not known. Usually the patient feels stronger in the morning and becomes tired and weak toward evening. Muscles most frequently involved are those of the neck, throat, lips, tongue, face, and eyelids. The disease comes on gradually, the patient first noting double vision, difficulty in swallowing, chewing, and talking, all these symptoms being worse in the evening. Eventually the face loses its normal expression, and there is drooping of the eyelid on the affected side of the face. This disease may apparently clear up, only to return several times during the lifetime of the patient. Treatment: complete bed rest is necessary during the acute stage of the disease. The patient should be given a general diet and a normal amount of liquid. Neostigmine is the best medicine. In milder cases a 15 million Guaranese tablet may be given 3 or 4 times a day. Medicines containing belladonna should also be given 3 times a day along with neostigmine. Some patients